All right. So welcome everybody. As you are coming in, I am delighted to see so many of you today. This is our first Zoom session of the Fall 2021 Learning Community Guest Speaker Series. And so just to kind of set the tone here today, we want to ask you to do a couple of things. One, if you can change your name in Zoom to list your name as it is now, but also list your major. Then that way our guest speaker, Dr. Martin, will have an idea of which intended majors are represented in our participant list today. And the other thing is if you can turn your camera on, and then that way we can have more of a shared experience in our Zoom today. And then at the end of the session, and you must be present to win, but we will do a prize drawing. And I believe we have, Brittany, what are our prizes for today?
3 umbrellas. So it is perfect for today.
Perfect for
in
the
particular.
rainy day. Exactly. So our theme this semester in our learning community is social justice and healthcare. And so I can think of no more perfect way to start that conversation out than by introducing Dr. Jamela Martin, who is one of our nursing faculty members, and she's going to talk to you about social determinants of health.
Okay, thank you all for welcoming me, and thank you all for being here as well. I know we're getting towards the end of the week. It's the evening. You probably want to be eating dinner and relaxing. And so it's really encouraging for me when I see so many students that will come to these types of presentations. We love to share the information that we have and just getting to connect with some of the students even before you embark in your respective disciplines. So I appreciate you being here. A little bit about me. I am nursing faculty, and so my background is as a NICU nurse, which is a neonatal intensive care nurse, and a pediatric nurse practitioner. And then I went back to school for my PhD in nursing. I've been teaching at ODU since I earned my PhD, which was in 2013. So it's going on close to 10 years now that I've been at ODU. And I have to say, I love working with the students. I love being able to be here with you all. And in fact, one of your student mentors was in my health assessment class this afternoon. And I think I had the same thing last year when I gave the talk to the health professions learning community. So it's really cool to be able to see her there and then scoot on home and be able to also hopefully see her here as well. So today we are going to be talking about concepts of health equity and social determinants of health. When I teach, I really like to use a lot of multimedia. I feel like my role as an instructor is not necessarily to reinvent the wheel, but it is to kind of procure the appropriate resources for the level that you are at and for the information that you need, pull those resources together in a way to make it make sense for you, and to also provide some interaction as well. So today, I'll be talking with you, and you can see that I have slides. I also have a couple of videos that I've embedded into the presentation that I thought were really great videos. I have a case study that we'll take a look at, and then there will be some points in the talk where I will ask you to take a few minutes to do some reflections. One of those is a 5-minute quick write, and I teach nursing research, and we do a lot of writing and research. Writing is a great way to reflect on what you've learned. So when it comes time for the 5-minute write, I actually do want you to either pull out a sheet of paper or type it into your computer and just type some reflection question or type some answers to the reflection questions. And then we'll discuss those at the end. And last year, everybody participated and it was great. So just to keep you guys kind of engaged, hopefully you will participate. So today our learning objectives are, let's see. No, it doesn't want to progress. Let's see if I can get my slide to progress. There we go. Okay. Learning objectives for today. So today, I would like for you to be able to understand the connection between health equity and social determinants of health. We are going to discuss what social determinants of health are and why they're important. We are going to try to understand how SDOH influences individual and population health. We're going to recognize important social determinants of health resources, such as programs, policies, and research for health professionals. And then again, as I mentioned, we'll reflect on how we can incorporate this knowledge into our practice. So even though I'm a nurse, I've created this presentation from a general, broad perspective that's applicable to all health professionals. And it'll be nice when I exit my screen that I'll be able to see all of your different majors and what you all are planning to do in your future. So, what is health equity? Let's take a look at what the World Health Organization says health inequities are, and then we can talk a little bit about what health equity is. Let us see. Now I'm going to, oh, there we go. Okay, let's see if I can go back to my PowerPoint. There we go. Okay, was everybody able to hear that video and see the video? Yes, no? Can anybody give me a verbal yes?
Yes.
Okay, great. All right. So that was the World Health Organization's Fast Facts on Health Inequities. And I thought that was a really important video to share because it really helps to situate our thought process for this presentation under a lens of social justice. And I think that you could see in that video that there are some social injustices going on worldwide in the sense that a lot of the conditions that people suffer from are not of their own doing or because of health behavior. It is because of other social factors that they don't have the power individually to change. And so it's important to kind of root our understanding of social justice in the ways that our society impacts individual health and population health as well. So that's what health inequity is. But what is health equity? So a lot of you may have seen this, or maybe you have not seen this graphic that I have on the screen here. But what it's showing 3 different individuals at a ball game. There's an adult, there's a child, and there's a baby. If we look at it, if we try to look at things or healthcare from the standpoint of equality, then we're going to give everybody the same leg to stand on. We're going to give everybody the same size box, and it's up to them to be able to see over the fence and see if they can see the game, right? That's pretty unfair to the baby because the baby can't do anything about being short, right? It's not the baby's fault that the baby hasn't grown yet. If we look at the right side where we're wanting to provide some equity, we see that we have given the child a box, we have not given the adult a box, and we've given the baby 2 boxes. And what that means is that sometimes different people need different things and different help in order to achieve the same outcomes. So we've, in essence, provided some level of equity in allowing all 3 of those individuals to be able to see the game. So one of the guiding forces for achieving health equity is Healthy People 2030. I'm not sure if you all have talked about this in any of your classes, but previously we had Healthy People 2020. Well, now we've passed 2020, and the U.S. Department of Health and Human Services and the Office for Disease Prevention and Health Promotion have established Healthy People 2030. And Healthy People identifies public health priorities to help individuals, organizations, and communities across the United States improve health and well-being. So with Healthy People 2030, it is the initiative's 5th iteration, meaning we've been building on knowledge gained over the last 4 decades on what we need to do to achieve health equity. So when we previously focused on the Healthy People 2020 goals, as I've said, we passed those. Some of the goals that we had for Healthy People 2020 were achieved and therefore not renewed in the sense of a specific focus for Healthy People 2030. But a lot of times we don't make the progress that we hope to see with our objectives, and then we will have those previous goals which were unmet that will continue for the next 10 years. One of those goals that I can think of is maternal child health. So we're still really working hard on maternal child health and achieving health equity for folks in the United States, but around the world. With Healthy People 2030, they provide these 10-year measurable public health objectives, and they're within 5 broad categories listed here. So the broad categories that they're focusing on are health conditions. So that would be things such as asthma, diabetes, tuberculosis, malaria. Health behaviors, which are what are the things that people do to keep themselves healthy. Populations, in other words, population health. What are the issues at the population level? Settings and systems. How do we change policies and change settings and systems to help everyone achieve better health? And then social determinants of health, which is actually fairly new for Healthy People 2030. So we have a whole section of Healthy People 2030 just focused on social determinants of health. I'm not going to go into all of the details. Within each objective, there are probably 15 to 30 measurable goals. And if you want some more information, please head on over to the Office of Disease Prevention and Health Promotion, and you can take a look at the specific measurable goals. But today we will talk in more detail about the social determinants of health. So what are social determinants of health? Social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So social determinants of health can be grouped into 5 main domains, and those are economic stability, social and community context, neighborhood and environment, healthcare, and education. So within each of those 5 domains, there are several factors that impact an individual and a community's ability to be healthy. And they don't necessarily pertain to a person's health behavior. And it doesn't pertain to a person's genetic makeup either. So let's look at the first. Economic stability. So for economic stability, there are several factors, and you can probably add to this list. I just put a short list for each one just to give you some food for thought. But economic stability for an individual is being able to get and keep a job, what kind of work a person does, and how well that type of job is esteemed within their community. How much money does a person earn, individually and within the entire household? And then are they food secure, meaning do they have access to healthy foods? In the United States, 1 in 10 people actually live in poverty, and many people can't even afford things like healthy foods, healthcare, and housing. People with steady employment are less likely to live in poverty and more likely to be healthy, but many people have trouble finding and keeping a job. And as we all know, the COVID-19 pandemic has tremendously impacted people's ability to find and keep a job. People with disabilities, injuries, or conditions like arthritis may be especially limited in their ability to work. And then many people with steady work still don't even earn enough money to afford the things they need to stay healthy. So along those lines, the Healthy People 2030 goal is to help people earn steady incomes that allow them to meet their health needs. And again, there are several measurable objectives in how well we are achieving that goal, so that we can look at our progress over the next 10 years and determine if we need to change our approach or we need to do more or continue on the same path that we're on. Next up is social and community context. So people's relationships and interactions with family, friends, coworkers, and community members can have a major impact on their health and well-being. Many people face challenges and dangers that they actually can't control, like unsafe neighborhoods, discrimination, or trouble affording the things that they need. And this can have a negative impact on their health and their safety throughout life. So positive relationships at home and at work and in the community can help reduce these negative impacts. But some people, like children whose parents are in jail and adolescents who are bullied, often don't get the support from loved ones or from others, from teachers in their schools. So we need to think about interventions that will help people get the social and community support they need that are critical for improving their health and well-being. I have on the slide here how a person develops during the first few years of life. In other words, early childhood development is a part of that social and community context, meaning their environment, where they're raised, the type of preschool that they can go to, their family members that they're around, really sets them up for success or not so much success. I don't want to say failure, but not so much success with their health. So the Healthy People 2030 goal for social and community context related social determinants of health are to increase social and community support. Next up, we have neighborhood and environment. So the neighborhoods that people live in have a major impact on their health and well-being. Healthy People 2030 actually focuses on improving health and safety in the places where people live, work, learn, and play. If you think about it, a lot of people in the United States actually live in neighborhoods with high rates of violence, unsafe air or water, or other health and safety risks. And unfortunately, racial and ethnic minorities and people with low incomes are more likely to live in places with these types of risks. In addition to that, some people are exposed to things at work that can harm their health, like secondhand smoke or loud noises. Residential segregation is another highly impactful factor of neighborhood and environment related social determinants of health, because the physical separation of races and ethnicities does exist into different neighborhoods. So we can see that the residential segregation, particularly if there aren't resources in the neighborhood, can have an impact on a person's ability to stay healthy. Interventions and policy changes at the local, state, and federal level can actually help reduce these health and safety risks and promote health. I'm going to give you a quick example. For example, providing opportunities for people to walk and bike in their communities, like by adding sidewalks and bike lanes, can actually increase safety and help improve health and quality of life. If you live in a neighborhood that is surrounded on all four sides by maybe a train tracks, a river on the other side, some, I don't know, big, big buildings where you can't walk, and then another unsafe neighborhood on the other side, you're less likely to get out and go for a walk in your neighborhood. You're more likely to experience pollution and that sort of thing. So we really have to look at ways that we can change the neighborhoods and environments. And one of the ways that people say place matters. And I know that Dr. Janice Hawkins, she'll be talking to you later in the semester about how your zip code can actually affect your health. I think you maybe saw on the slide or on the video that I just showed over in England, they mentioned that for each tube stop, the tube is the train there, for each tube stop away from the major city into a more rural area, they can see an increased risk for certain diseases, simply based on moving further away from the areas where people have access to clean water and, non-polluted environments and walking paths and that sort of thing. So the Healthy People 2020 goal is to create neighborhoods and environments that promote health and safety. Next up is healthcare, and I know this is near and dear to y'all's heart because you are going into healthcare as students, but many people in the United States don't get the healthcare services that they need. About 1 in 10 people in the United States don't have health insurance, and people without health insurance are less likely to have a primary care provider. They might not be able to afford the healthcare services and medications that they need. Not only is access to healthcare services important, but access to quality healthcare services is important. And we would like to think as healthcare providers that any provider that you go to is going to provide quality care. Any hospital that you go to, any clinic you go to is going to provide quality care. But unfortunately, that's just not the case. And what we will find is that racism actually is a public health crisis, because racism that individuals experience from healthcare providers can actually impact the quality of care that they receive. So, oops, this is being very touchy. I'm sorry, you guys. Let's see if I can get you back. There we go. So what we need to do is we need to focus on strategies that will increase health insurance coverage for all individuals. One example that you guys can probably think of is Obamacare. And even though there are some issues with the Obamacare program, we're still working on ways that we can improve insurance coverage access for everyone. And they are working on improvements to that program. Sometimes people don't get recommended healthcare services like cancer screenings because they don't have a primary care provider. And then other times it's just because they live too far away from healthcare providers who offer that to them. So, and again, we know that non-whites experience racism from healthcare providers that will impact their ability to receive appropriate services. And then education. So education is our fifth social determinants of health broad category. And we know that people with higher levels of education are more likely to be healthier and live longer. Children from low-income families, children with disabilities, and children who routinely experience forms of social discrimination like bullying are more likely to struggle with math and reading, and they're also less likely to graduate from high school or go to college. So this means that they're less likely to get safe, high-paying jobs and more likely to have health problems like heart disease, diabetes, and depression. And then there are some children who live in places with poorly performing schools, and many families just cannot afford to send their children to private school. So early childhood development, as I mentioned previously with preschool, is very important. Language and literacy, being able to attend a school that has the resources needed to teach the content that they need to learn. And then access to mass media and emerging technologies like cell phones, internet, computers, even social media like Twitter and Facebook and Instagram, where they can have not only that social support, but then they can also learn how to use that type of technology. So the Healthy People 2030 goal related to education is increase educational opportunities and help children and adolescents do well in school. Okay, so next up, we're going to look at a case study. So this case study is from a video series called Unnatural Causes, and it's a critically acclaimed 7-part documentary that explores racial and socioeconomic inequalities in health. It was broadcast by PBS over a decade ago. It was first broadcast by PBS over a decade ago, and it's a 4-hour series that crisscrosses the nation to uncover startling findings that suggest that there's much more to health than just bad habits. It was one of the first times that we really took an honest look at social determinants of health. So this excerpt is episode 4, Bad Sugar, and it's about water rights and diabetes in Arizona. The Tuano, O'odham, and Pima Indians of southern Arizona have perhaps the highest rates of diabetes in the world, yet the disease was virtually unknown there 100 years ago. Over the last century, the diversion of river water to upstream white settlements cost the O'odham their crops, livelihood, traditional diet, culture, and health. Today, community advocates hope that restoring water and renewing culture can help improve health. So let's take a look.
There's a direct connection between the diversion of water in the upper Gila River and the health status and economic status of Pimas and Maricopas. In the 1890s, water simply stopped coming down the Gila River.
Upstream, water from the Gila was diverted by dams and water projects, giving white settlers, farmers, ranchers, and mining interests the water they needed.
And we were dependent upon that water to grow crops, to provide for ourselves.
Not even the 1908 Supreme Court decision upholding water rights for all Native Americans could protect the Pima. The Coolidge Dam. In 1930, one of the largest in the world. Its promise to provide water for everyone, this time including the Pima. Former President Calvin Coolidge celebrated its opening with politicians and businessmen. They dined on china, crystal, and linen. The Pima ate bagged lunches on makeshift tables. Coolidge passed the peace pipe, but in the end, the Pima got little of the water. Again.
We were practically without water for almost an entire century. We were among the poorest people in the United States of America, as are Indians who live in other reservations and still are in that situation. Unable to grow crops, unable to get out and work in the fields, unable to develop economically because of the lack of water for almost 100 years was just, that's an absolute shame as far as this country is concerned, as far as the state of Arizona is concerned.
What is a metaphor for the rest of the country to try to think about in terms of damming the rivers? It would be like saying to this entire country, okay, survive now without money. And how would you do that? How would you change your entire economy? How would you change your entire culture? How would you change your entire lifestyle? And would you be successful? Would people die?
And the Pima did die, but they died from starvation, not from diabetes. A survey conducted in 1902 found only one case of diabetes among the Pima. But within 30 years of building the Coolidge Dam, there were more than 500.
If we had not dammed the rivers back in the 1920s and 1930s, we wouldn't be able to have this lifestyle that we enjoy in Arizona with swimming pools and golf courses and artificial lakes. And with this lifestyle, we're really living outside the laws of nature. And what people, I think, generally speaking, don't realize is that all of the prosperity of Phoenix and the prosperity of this entire state was built on the backs of the health of the local tribes.
Pimas lived a very, very difficult life at the bottom of the economic scale. We had almost no recourse except to become dependent upon governmental benefits.
Shortly after the dams were built, the U.S. military began distributing free commodity foods to Native Americans.
And it definitely brought us through the hard times. This is the commodities building, where they host the commodity food. This is where people used to come get their cheese, their beans, and their grape juice and stuff. They used to be just rows and rows and rows and rows of those.
But this surplus food, white flour, cheese, refined sugar, lard, canned foods, is a diabetic's nightmare, as it was for Terrell's neighbor.
They asked her how many people were in her household, and she said about 5. And the guy said, well, you can get 5 boxes of food. And there was chips and candy and canned food. And I thought, well, that's an idea. There's a nice idea about having food, but it's just the wrong kind of food. And I asked her, I said, so what kind of, like, were there any kind of normal food? She goes, well, there were cans of gravy.
It was not until 1996 that fresh produce was offered in the program, and authentic traditional foods are still not included.
When we think of traditional American Indian food, for example, fry bread is one of the things that comes to mind. Well, in truth, tribes did not have fried bread historically. The roots of fry bread are in the commodity food program. And fry bread is essentially trying to do the best that you can with your commodities, flour, lard, and vegetable shortening. Over generations, when people grow up with that, it becomes a part of the culture. It becomes acculturated into the community that is part of the norm.
There is only one small market on the 581 square mile Gila River Reservation with a small produce section. A regular supermarket is an hour's round-trip drive.
If you're in an impoverished community and you don't have healthy choices for food and you don't have safe places to exercise, you're tremendously disempowered when it comes to a disease like diabetes. And that has nothing to do with how much medication is in the pharmacy. It has everything to do with social determinants of health, which include that sense of control, that sense of self-empowerment that is important to all of us, whether we're Native or non-Native. It has an impact on self-identity, and it has an impact on one's sense of hope for the future.
Some of our people have just given up. People lost their identity when we lost our water. Within our community, we have elders that have gone. I always have that in the back of my mind, that those people will never see the water. when I leave the reservation and I see those same people that live out there and use that water, how they've benefited from our loss. They've benefited so much for so many years.
Decisions to benefit some are made every day. They create winners and losers in wealth and in health. In upscale cities like Scottsdale, Arizona, the diabetes rate is only around 5%. In less affluent towns like Bullhead City, the rate is closer to 11%. And on some poor Native American reservations, it continues to be 50%. This is a disease pattern repeated across the country, across the world, and not just for diabetes. Whether you are poor or wealthy or in between, is a powerful predictor of how healthy your life will be.
Okay, so I'm going to stop sharing for a minute, just so I can see your faces and take a little bit of a break. I can't see you all when I have my screen up, so I wanted to just take a little bit of a break. What do you think about 1 in 581 square miles, one market within 581 square miles? Can you imagine? And you saw the market there with the healthy produce, and the market itself was fairly small as well. Can you imagine the struggle to get decent food to eat if you have to drive for over an hour to get to the market? So, those are the things that we don't necessarily think about. And I'm sure when the settlers came, they may not have thought about the fact that downstream there's this community that if we completely stop the water, we will see all of these issues down the line. They needed water too. So it's not a matter of the settlers shouldn't have had water, but how could it have gone to where the settlers could have water and it didn't impact the Pima also? So those are the things that we think about now as we are developing areas, is how are we impacting those around us? So here is where let me start sharing my screen again, because I have a little bit of a discussion that I want us to have about this particular video. So here are some reflection and discussion questions. And this is where I would really love for you to unmute and just, give your thoughts about it. So the mystery: why do the Tohono O'odham and Akimel O'odham Pima tribes in Arizona have some of the highest rates of type 2 diabetes in the world? Some of the themes are poverty, oppression, disempowerment, and futurelessness that are health threats. Diabetes rates that are disproportionately high among Native American tribes who have been deprived of their traditional livelihoods and way of life. And community self-determination, which is an important health promoter, and the community may feel powerlessness. So what are some examples from the video that you just saw of these three themes?
I didn't say it was a bad idea. Why is everybody?
Anybody feel like sharing? Okay. Leanne says the Coolidge Dam built in 1924 to 1928, and the Native Americans did not have U.S. citizenship until 1924. So what that means is that they couldn't even advocate for themselves until 1924. That's very true. What other, what else stood out to you in this video?
I would say the fact that like the supermarket that had the all the healthy stuff was far away from them.
Right, absolutely. So we mentioned just being able to get to a supermarket for healthy foods. And imagine that if you have only one gas station that you can go to in a 500-mile radius, how expensive will that gas be? Lindsay said that the foods the tribes were given were extremely unhealthy. Yes, Lindsay, that's correct. So what happened in terms of that? Like, what can you expand on that? Or can anyone expand on that?
I was going to add that in regards to theme number 2, where it says that they were robbed of their traditions when they were given those foods, they weren't able to cook the traditional foods that was, apparent in their culture. So that in a way took away some of their culture.
Right, absolutely. So they were farmers, and so they were growing their own healthy foods, but they relied upon the water in order to grow those healthy foods, and then those healthy foods were exchanged for program foods that weren't very healthy, and they had to change their way of living and their native foods, their cultural based foods, to utilize what they were given, which was not a whole lot of healthy stuff. And did you guys notice that they said it wasn't until 1996 that the food program began to incorporate fresh food? That wasn't that long ago. I graduated high school in 95. So it's been very recently that that the food programs have focused on trying to provide healthier foods. But as long as it took for the diabetes epidemic in the Pima tribes to begin, it's going to take a long time for it to subside. What about hunting? They were probably able to hunt. That's right. So they were probably able to get fresh meats.
But wouldn't, since they didn't have any water, wouldn't the animals die?
The animals
from
would
them
probably
hunting?
die as well. Yeah. If they had animals, if they had livestock on their farms, not being able to provide water for their livestock. What else? What about the community self-determination? That's a big piece of it as well. What does that do to people's will to remain healthy?
To me, it's the futurelessness part that really hits me, is that we've been talking about that recently in my class. When people do not have a sense of hope, and they don't have a sense of a sustainable future, then even if healthy stuff is available, I mean, people are really more likely just to give up, and so it's the futurelessness. That's interaction theory at work, is like the perception of no hope for tomorrow, no hope for the next week. And certainly, we were talking about elderly people in my class today, and how the older people get and the less they have social bonding, the more likely they are to give up on their medications or give up on on really trying to make it to the next day. So, I mean, I think that sense of hopelessness needs to be addressed as well. And once that gets ingrained in somebody, I think it's very hard to get rid of when these people are surrounded by really no sense of hope.
Absolutely.
But I mean, we don't have to go to the reservation for that. That happens here in Norfolk all the time.
Mm-hmm.
So, I mean, but it's a good example of how something historical that's led to present day suffering of a lot of people, I mean, is relevant in this area. I mean, you don't have to walk 2 blocks to find people that are suffering from food deprivation and lack of health care. So,
and the hopelessness as well, just feeling, like you said, just feeling stuck, feeling powerless.
Yeah, and you're just less likely. Not only are you less likely to give up, but you're more likely to turn to ways of dealing with it that are very unhealthy. Drugs, alcohol, just to make yourself feel better for the moment.
Right. Absolutely. And then I don't know that you all know this, but the concentration of alcohol at the liquor stores is a lot higher in urban areas than it is in other suburban areas. So that further encourages the use of um, non-healthy behaviors in really trying to deal with the struggle that people are facing. Okay, so let's go back to, oh, I think I lost my my little display, but we're kind of almost to the end. So, and I know that we're almost at 6 o'clock. So what are the implications for you all? So what does it mean for you as a future health professional? Well, it means that you have some work to do, and but you can and you do make a huge difference in the way that you address social determinants of health for your patients. So you need to know what kinds of questions to ask. It can be very difficult when you're first starting out and you're working with patients and clients to broach those topics, but it's important. And what you'll find is that if you take the time to ask clients about specific social determinants of health or how they're doing in that realm, you will find that they are extremely happy to share with you the struggles and the things that prevent them from being their healthiest selves, because it's not that people don't know. They know, just like anyone else knows, what they need to do to remain healthy. But what are those other barriers that are preventing them from doing so? And if you can ask them about that, help them to open up to discuss those, then maybe there are some solutions underlying that you can help them with as well. We want you to serve as client and community advocates to address the health inequities and disparities. And we want you to begin raising public awareness of how social determinants of health affects the health of the communities around you. So in order for you to do that, you as health professionals have to know what social determinants of health are, and you have to be able to recognize those negative social determinants of health when you're interacting with your clients. One other caveat, and one other thing that I want to mention is that sometimes people will talk about social determinants of health as an inherently negative thing. They'll say, well, I met with patient so-and-so and she has social determinants of health. Well, yes, she does. We all do. I do as well. Every single one of you that are here tonight have positive and negative social determinants of health, things that help you be healthy, things that kind of are barriers to you being healthy. So just keep that in mind. All right, so we're gonna, let's see, just a second. Am I sharing my screen? No, I'm not. Okay, let's see. Oh, okay, I just closed out my PowerPoint too, so give me just a second. I've got too many screens open.
So I'll mention while you're looking or you're getting yourself set up for the next part, in addition to Dr. Hawkins, also from the School of Nursing, talking about the impact of where you live and how it impacts your health. So digging deeper into these topics, Dr. Leslie Hoagland from the School of Community and Environmental Health will be talking on October the 21st about food security.
Did we lose you?
I think did I hit the mute button? Okay, so Dr. Hoagland will be talking. She's from the School of Community and Environmental Health on October the 21st about food security and salutogenesis, which Dr. Markin could explain better than I, but I believe it's about what impacts us to make choices related to healthy behavior, or how we build healthy behaviors in some ways, and how food security, access to food, some of the examples that you gave us can impact those things.
Mm-hmm. Absolutely. Food security is such a huge portion of the impact of social determinants of health. And I don't know if you noticed early on in the slides when we were talking about the 5 main domains, I had food security on a couple of the slides, and honestly, it could have gone on every single slide, because food security is a function of healthcare. We use food to stay healthy, you know. Food security is a function of your environment, as we saw with the Pima Indian tribe, and here right in Norfolk as well, access to a market with fresh foods. It's a part of education. We have to teach our kids. They don't just grow up knowing what's healthy food and what's not healthy food. We have to teach our kids that, but we also have to provide that in the schools as well. So food security is a huge component of social determinants of health. It's a huge component of how healthy people can be. And so I look forward to hearing the recording from Dr. Hoagland. I've worked with Dr. Hoagland as well on some papers and chapters about health inequalities and racism in healthcare, and she's great. So I know you'll learn a lot from her. So what can you do? So what can you actively do? First, you can familiarize yourself with national, state, and local programs that address social determinants of health and support clients' needs. With the CDC alone, there are close to 20 active national programs. Just a couple of those, they have a program called Built Environment and Health Initiative. And the purpose of that program is to design and build healthy places. So they're working on community design decisions to better impact health. So how do we incorporate green spaces? Where do we put the parks and the walking paths? How do we situate the roads so that they're not an impediment to people getting out and walking and being healthy? Another program is Choose Safe Places for Early Care and Education. And this program aims to protect the health of children where they learn and play to reduce exposure to dangerous environmental contaminants. So if you live next to a huge power plant or a steel mill, if you live somewhere where wood fires, where they're making coal, then you might have a higher asthma rate. So these Choose Safe Places for Early Care and Education aims to send young children to preschool and to care centers where they're not exposed to these environmental contaminants. And then a third program is the REACH program, which is Racial and Ethnic Approaches to Community Health. And that brings together members of the community to establish community-based interventions and programs for racial and ethnic minorities. At the state level, the Virginia Department of Health has a data portal where you can view social determinants of health and health indicators by location. Other examples of state programs include food security programs like the Food Bank of Virginia, the Children's Health Investment Program that focuses on early childhood health and education. And then Virginia 211. And I don't know, hopefully you guys have heard of Virginia 211. But just like 911, where you can call the emergency line to get some assistance, just like 411, where you can call just for general information. And I think it's 511, that's for the roads and transportation. We have 211, you pick up the phone, you dial 211, and it is the Health and Human Services hotline that connects individuals to resources to help meet like social and health needs. So anyone can call that number. You and I can call that number. We can call on behalf of our patients. And in the interprofessional clinic work with Centera with students, we often will pick up the phone and call Virginia 211 and tell them, I'm working with a client. This is the background. My client is facing eviction in 3 days, and we really need to find some housing backup for him, her, or them so that they don't become homeless. And they will help you find the local resources and connect you to those resources so that you can help your client. And then locally, we have the physical therapy clinic, the dental hygiene clinic, and the nursing primary care clinics at ODU. And all of those serve underserved individuals in our local communities. As I just mentioned, the Centera Ambulatory Care Center has an interprofessional clinic that specifically addresses social determinants of health for clients. And these are 2 to 3 hour appointments where a multidisciplinary team of students, actually it's student-led, will work with a client to provide them direct assistance in getting resources such as housing or disability paperwork filled out, or help them fill out a SNAP application so that they can receive. SNAP is the new term for food stamps. So to help them fill out that application so that they can get access to better foods. And then health policy and advocacy along with research. So you can read up on health policy and advocacy efforts that you can get involved in to help address SDOH at a population level. Get involved in professional conferences and meetings. There's a summit called the RISE Summit that happens annually, and it's specific to social determinants of health. It's an annual meeting where professionals and thought leaders come together to discuss actionable, tactical, and scalable solutions to SDOH challenges. You can get involved in professional organizations. As you begin to take your classes in your respective disciplines, you will find that there are professional organizations within each discipline. And within those organizations, they have chosen specific issues that they support and advocate for. So what you can do is begin learning about the organizations within your discipline and what they stand for. An example for me is the American Association of Colleges of Nursing, and that is the guiding body for any faculty member or nurse who teaches nursing students. And they provide grants, they provide guidance, they provide resources to help us as nurses teach about social determinants of health. You can even seek and sign petitions on change.org. You can support the Virginia Hospital and Healthcare Association by becoming a healthcare advocate in your community. And there's a sign up on their website where they will send you information about advocacy activities going on in your local area and give you some information about how you can get involved. And then in terms of research, the AHRQ, the Agency for Healthcare Research and Quality, is for any health professional. It's a great resource to get up-to-date research information on all health topics, including social determinants of health. And their mission is just to produce evidence that makes healthcare safer, higher quality, and more accessible, more affordable, and more equitable. And then finally, you can just simply volunteer with a nonprofit organization. I know that we are all slammed with schoolwork and home life, and maybe you even have a job. If you can squeeze out a few moments of your time to volunteer with a nonprofit organization, that's one way that you as a health professional can continue to address social determinants of health by providing manpower to the organizations who are on the front lines.
I wanted to share a couple of examples. Obviously, we have the food bank, which is right down the street. We also have a food pantry here on campus, which is, they're always looking for volunteers. It's a great way to get some of that service learning that you're going to talk about in your Health 101 class, but to help out your campus community as well. And then the St. Paul's Community Development Corporation specifically focuses on the neighborhood over in St. Paul's, which the city of Norfolk is currently looking at and developing. It's a food desert. And so one of the things that they're looking at is providing, or they're actually doing, is providing a food pharmacy program. So prescriptions for healthy food that is then delivered to individuals who otherwise would have, a very difficult time getting fresh, healthy foods and vegetables, fruits and vegetables.
Absolutely. There are so many ways to get involved. And, for every student that's here, there is another organization that's out there that might be of interest to you that you could get involved in to share a little bit of your time. Some other recommendations, the World Health Organization recommends that we improve daily living conditions. So we're going to improve conditions where people are born, grow up, live, age, work. You can use, as a health professional, you can use motivational interviewing and therapeutic communication to understand their living conditions and make referrals to improve their individual conditions. Tackling inequitable distribution of power, money, and resources. We have to address those issues at local to global levels. So local, regional, state, national, and global. Get involved in public health organizations, advocacy organizations in your field, and through individual advocacy action. And then we're going to have to measure and understand the problem, assess the impact of action, and see what we need to do next. So one of the ways that we are trying to do that as health professionals, educators, is develop a workforce that is trained in social determinants of health. And we're trying to raise your knowledge and awareness of the importance of addressing social determinants of health. We would like for you to focus on social determinants of health with every patient, every client encounter, every assignment, every assessment, and including your care plan. Always have that as a lens as you're evaluating your clients or going about your assignments. Okay, so I think because we're already at 6 o'clock, maybe this is something that you will need to do this evening or later. And I think it will be up to your instructors if they would like for you to submit this in some other sort of way. But the questions that I had for today about our presentation is, why is it important for health professionals to address social determinants of health? What are health inequities? Which US populations live longer, healthier lives? And list 3 reasons why. And then if you could wave your own magic wand, what 3 things would you change to close the socioeconomic and racial health gaps? There's a lot of work to do. So it's great when you can think of what you're really passionate about and how you can wave your magic wand. Sorry, I have a dog and he's old and he's yelping in the back to come out. If you can hear that little whine. So really think about these things and reflect on what you've learned today. To summarize, social determinants of health are a collection of social and environmental factors that influence health. They're not genetic or behavioral, meaning you're not born with them, and it's not something that you are doing. It is something that is an effect of where you live, grow, work, play, worship, etc. All individuals are influenced by social determinants of health. Again, as I mentioned, they're not inherently negative. There are positive and there are negative impacts of social determinants on individual health and on population health. We as health professionals are in key positions to assess for these factors and integrate this knowledge into the care of our clients and our communities. But first, we have to ask the questions. We have to not be afraid to ask the questions. How are you really doing? What are the things that are preventing you from being your healthiest? And then keeping in mind that health equity can only be achieved by closing the gap on social determinants of health. And here are some select resources should you want to write these down and take a look at them for more information. I think Unnatural Causes is great. There are so many clips there. You have to actually pay for the full 4-hour video, but there are actually several other case study clips on there that are really interesting to listen to, and lots of tools in the toolkit and additional readings that you might find interesting. And I'm going to stop sharing because that is the end of my presentation. So does anybody have any questions, any concerns, any thoughts they'd like to share with us before we go?
I'm just glad you mentioned early childhood and early childhood education and childcare, because we were actually talking about that in history class yesterday, but in the context of women's equal rights and having the responsibility for childbearing and child rearing. And I told him about how expensive it is for me to send my children to daycare, $900 a month. It's ridiculous. And how if you can't afford that, what can you do? And so it's both impacting the children, and I'm thankful that my daughter has been able to go to a very, very good childcare. But what about for the children and for not just the mothers, but parents in general?
Absolutely. I mean, and it's like college tuition to send one infant to daycare. It's extremely expensive. And if you don't have the social support, what do? Used to be where there was a village and you had family members that lived on the same street, and you could just send them to grandma's house or your aunt's house across the street, and they would be taken care of. Now that's a little bit more difficult because people are moving around. So if you don't have that social support, where do you send your child, especially if you don't have the finances to send them somewhere that's regulated by the child care regulating agencies? You have to do the best you can, but that first 5 years of a child's life is extremely important in their future development.
Dr. Martin, just on a more practical note, you were talking about being able to donate on campus food. I didn't catch where we can do that, but I do guarantee you that. I mean, I teach about 200 plus students right now, and there are students that would benefit from that. I mean, there's all kinds of students at ODU, and there are students that really could benefit from food. We have commuters, it's not everybody has the Broderick meal plan.
Right.
And yeah, so I mean, that would be useful. That would definitely be useful to have that link. I think that's important. I didn't even realize that. I know at Thanksgiving they put boxes around, but I didn't know that we had like a constant thing going on like that.
I think Leanne posted it in the chat, and there's a link. I accidentally just clicked it. I don't even know if I'm still screen sharing, but I can share my screen. This is not only for you to donate, but if you need the help, then you can Ignite Food Pantry. So I clicked the link that she posted, and you can read about it. And I'm sure there has to be some contact information in here somewhere about how you can donate.
Well, Ignite is over there on 49th Street, right?
Yeah, there's actually a second food bank.
Yeah.
The Monarch Pantry is one that is more affiliated with ODU now. And for all of the students on the call as well, it's the second one that Leanne just put, the ODU feed. There's also push notifications that you can receive after every event. If there's extra food, the host can actually push out a notification to you all on your phone, and you can get leftover food that way as well. So, Jonathan, if any of your students too in your other classes.
And then out at the Virginia Beach Higher Education Center, because I know we're a little bit removed from main campus, we do have a food bank, a food pantry as well, that is run by the fellow that runs the library. So the faculty typically will just donate to that, because we do have a lot. I think we've already had 20 requests from just our nursing students alone for, because they don't have the finances to eat well. So.
And then Dr. Martin, if you don't mind sharing your PowerPoint, we can send that out. I'm going to post the recording of this, but we can send out the PowerPoint with the links and the videos. And I will offer 10 points extra credit for anyone who answers those questions. So I will post those questions as well before our next guest speaker on October the 7th. I don't know if Professor Lopez has a similar incentive for students to think about these questions, but I will post that this weekend once I get that from Dr. Martin.
No, I just figured they're going to do it because they care.
That's also a good reason, but I'm gonna throw down 10 points.
You heard what he said. That means do it, even if you don't get any credit. Well, thank you so much. I will absolutely send my PowerPoint. I know it was a quick run through of a lot of content. Please feel free to reach out to me, email me if you have any questions. I see a lot of nursing here. For the ones I see biology, but even if you're not in nursing, please feel free to email me. And I think that we have a drawing for those who are still here.